Welcome. This is the first self-learning online CPC from JCU. We are trying it out to see if you can learn all on your own. It has all the lectures, self-assessment, online keypads. We have tried to put many things in this, so please let us know what you think. Is it working? So the first self-learning CPC. It's a case of snake bite. Although the patient has come with just a shock and a bleeding tendency, so we are trying to cover the issues, learning issues we have not covered in other CPCs. That is, clinical assessment of shock, assessing a patient with bleeding disorder, and just basics of transfusion, minimum. Okay. So, patient is an 8-year-old boy from a bush area, North Queensland, presented to emergency department with multiple small bruises on his legs. Just for last few hours, he has come back while playing from in the bush. The aim of this CPC, as I said, to train students in clinical pathology and population study of patients with bleeding disorders, shock, and just basics of blood transfusion. So taking history, clinical examination of specifically patients with bleeding disorders and shock. Briefly review of basic sciences, pathophysiology of shock, types, the clinical features, different types of shock. And then pathophysiology of blood clotting, your MBBS year 2 learning, HRM, coagulation, extrinsic, intrinsic pathway, the coagulants, anticoagulants, okay, and of course the new topic, basics of blood transfusion. You have done a bit of it, that is blood groups, but we will be covering a bit more of practical application, decision to transfuse, when you have to decide to transfuse, what patients require transfusion, what type of blood component they would require commonly, what are blood groups, how do we do typing and cross-matching before giving transfusion, and briefly what are all the common reactions and side effects of transfusion. Okay, so I'll start with first basics. Hemostasis, physiology of blood clotting. Please refer to your book Hematology. Coagulation factors, enzymes, cells, extrinsic and intrinsic pathways. Important is know PT and PDT. Okay, PT, the short extrinsic pathway measuring test, common in acquired disorders of bleeding, all types of adult bleedings, acquired, not congenital. Okay, unlike hemophilia. Commonest is liver disorder, vitamin K deficiency, and then the intrinsic pathway, the APTT, the long burr pathway, intrinsic, more common with congenital hemophilias. Okay, so the two pathways, and when both the pathways are abnormal, we suspect systemic, that is acquired conditions of extensive stimulation of hemostasis, coagulation, and that is more common with DIC, snake bites, extensive trauma, post-surgery, burns. Okay, so coagulation pathways, read about it. Shock, different types of shock, vasovagal, neural, cardiac, hypovolemic, and the common types clinically. And then the blood groups, understand the basics of blood groups, the ABO group and the RH group. So ABO and RH only, and in the RH, D antigen is the most common, C, D, E, but D is the most common. So when we say AB positive, what do you mean? A positive or A negative, what does it mean? What are all the common blood groups? Who can give blood to any other blood groups? So some common features. So pathological is mainly studies are shock, different types of shock, and its pathophysiology, what happens, blood pressure, volume, kidney function. Common clinical bleeding disorders, platelet disorders, coagulation disorders, and vascular disorders, blood vessel damage. So common conditions. In your clinical practice, the most common is thrombocytopenic, decreased platelets. Then next comes the coagulation disorders, bleeding due to deficiency of coagulation factors or anticoagulants. Blood transfusion, the basics, cross-matching, and how to transfuse. And then we have added a bit of snake bite, common types, the brown snake, the commonest, the tiger snake, the black snake, and the common pathogenesis, that is bleeding with brown snakes, black snakes with the neural, muscle damage. There are different types of snake bites, so we will cover basics of this, and then we have given more self-study reading materials. Now, clinical core learning issues. This is developed by our clinical team, Dr. Paula and the team. Clinical assessment of the bleeding patient, laboratory assessment of the bleeding patient, what investigations you would ask for, clinical assessment of shock, how do you classify shock, indications for anti-venom use, that's for snakes, snake bites, safety, complications and anaphylaxis reactions of anti-venom use, blood transfusion, blood types, cross-matching and transfusion reactions. And briefly overview of different blood components, means whole blood, platelets, cryoprecipitate, or just RBC concentrate, packed cells. Okay, thank you. So this is just a brief overview. We hope you like this course. We have put more reading materials and we welcome your feedback. Good luck. Thank you.